Well, joining us now, Dr. Jan Cedric Hansen, medical consultant at Strat Advisor, and also advisor to the West African Health Organization. Thanks for being with us here on France 24. The reopening of schools was now the right time to do it?
Yes, well, it's important to go back to normal life in a certain way, but it is more important to rebuild the health system in those countries and to monitor what's going on, because we are happy the disease and has dampened in terms of number of new cases, but still we have 1,000 deaths still for the past 40 days, and we have 3,000 more cases. So there is still an ongoing outbreak, but it goes slowly, and I think the population can try to invest in normal life, certainly.
All right, the disease subsiding, even if, as you say, still 1,000 killed in the last 40 days.
Yes.
Why is it subsiding?
One of the main reasons is we have noticed a lot of mild cases of Ebola, which means that part of the population has been vaccinated in a certain way by a natural occurrence of the mild disease, which occurred like
They developed a resistance.
Yes, and they have now a kind of a resistance. And what will happen in the coming months is either we'll see a rebirth of the disease or a complete dampening up to maybe a minimum number of new cases as an endemic behavior of the
So
disease.
it's not down to the efforts of healthcare workers?
Both. I mean, the healthcare workers have helped people to survive the disease, because we have facing a disease that has 90% of deaths at the beginning of the outburst, and now it ended up with only 30%, or roughly 30%, 1/3 of people. So healthcare has definitely helped people to survive. And survivors are also people immune to the disease, and they protect their community by being immune by themselves.
All right, so it could go one of two ways, you're saying. It could either get worse again, there could be another spike, we don't know yet.
We don't know yet, but it is quite common with that kind of outburst, not specifically of Ebola, but any kind of disease, like a virus disease.
Big epidemic.
Yeah, big epidemic, to get a second burst. So we should be cautious in the coming months.
All right, should be cautious. You mentioned that the healthcare system in these countries has to be rebuilt. We know Liberia, all those healthcare workers who were on the front line of the disease and who died.
Absolutely.
With those leaders in Brussels today, how do you rebuild, I don't know, a nursing staff, doctors? How do you do it?
Well, you have to call for them to come, because it takes 10 years to get a new doctor. It takes 5 years to get a good nurse. So you should have volunteers to come in those countries. So you have to attract them, and to attract more local doctors, which are nowadays flying from their countries. So you have to offer good practice conditions. So you have to rebuild the whole system. But more important, you need to have healthcare professionals who are able to monitor the population, the health status of the population, because the more the health status is stable, the better the economic condition of the country, the more investors you get. And it is kind of like a wheel.
A virtuous cycle.
A virtuous circle. The more you get a healthy population, the better you are in your ability to develop your economic system. And the opposite is true as well, because Ebola, actually, the biggest issue of Ebola is the economic impact, and we discussed this here at the beginning of the outburst.
That's right. A combined drop of 12% in GDP for those three West African nations.
It's enormous.
It's enormous. When you look at the way now that the death toll has gone, nearly 10,000 killed, when you think back to last April when it first began, could that number have been lower?
From the time we lost at the beginning of the outburst, when it comes to a new epidemic, the first days are crucial in order to stop the spread of the virus within the population. And speaking of population with lots of movement, I mean, it's a young population with lots of movement. People are moving with goods and individuals all over the area. Borders are not really formal, and people go cross borders, I mean, in a way we wouldn't imagine in Europe. It is important to have the ability to close the borders at the very beginning, to isolate the groups that have been contaminated in order to stop the spread of the disease. And we lost so many days and weeks at the beginning because the countries could not, were not organized, didn't have the appropriate healthcare system in order to identify the outburst first, then to isolate the people that are contaminated, and then to treat them. And we lost too many days at the beginning. So the death toll is quite not that heavy compared to the time we lose at the beginning.
It could have been worse.
Yeah, it could have been worse, yes. I mean, there has been a tremendous good work on site by all the healthcare workers and volunteers.
It could have been worse. We saw there was a bit of jostling between, on the one hand, the aid organizations, on the other hand, the politicians, both West African politicians, and also, you could say, here in Europe.
Absolutely, yeah.
What are your thoughts now? What's the lesson you've learned?
Well, when we were talking about hundreds of thousands people in touch and maybe dying from the disease, it was it was ridiculous. That
was the World Health Organization that came up with that number.
Yeah, but I think at that time when it popped up, we had other predictions which were closer to the actual figure, which was roughly 20,000 death toll, and we are up to 10,000. So I think this was more realistic, and this is due to the tremendous work on sites.
The tremendous work that was done on site. Yeah. And at the end of the day now, do you get a sense that it's going to be short attention span, or will there be, like with this conference that's taking place in Brussels today, will there be a follow-through in helping West Africa?
We need to. We should to. I mean, it is very important to help them to divert 15% of their GDP to health care. If they want to be prepared.
Right now, what are the numbers roughly in those three countries? What percentage of the budget goes to healthcare?
I think that, well, last time I read something about it, it was between 3 and 5%. So from 3 to 5 times lower than it should be. And I think that from the state they are now and the economic position they have, we need to help them to reach that figure on the first move, and then help them to do it by their own. What has happened is there is now a huge concern. There will be a very important meeting on the 12th and 13th of March in Niamey.
Capital of Niger.
Where you will have all the health, the health ministers of the ECOWAS region.
Of the West African regional body. And
they will be there and meet together in order to rebuild and to build a new task force, to create a regional fund in order to respond to future outbursts. So there is now a huge concern about cooperation, working together and count on themselves. Because up till now, health was more a matter of European or American help, or World Health Organization help. Now, what rises is that they should be...
The strategy has to come from West Africa itself.
From themselves, and I think that's a good thing.
And once again, your call, Jan Cedric Hansen, to get more doctors and nurses to go to these countries and replenish the staff there. Yeah,
we should maybe consider, going there for 1 or 2 years, interning when we leave our schools in Europe, and maybe this would help them to cope with their health issues.
All right, I want to thank you. Jan Cedric Hansen, medical consultant at Strat Advisor and advisor to the West African Health Organization. Thank you for being with us here on France 24.